Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and vice chair in the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team working in hard-hit communities across the state of Georgia, and I am the host of Emory's COVID-19 Facebook Live events, where we discuss important topics in the COVID-19 pandemic. And today, I'm very pleased to be joined by my colleagues, Dr. Colleen Kelley and Dr. Aneesh Mehta. Dr. Kelley is an associate professor of medicine in the Division of Infectious Diseases at Emory University School of Medicine. Dr. Kelley is a site investigator for the HIV Vaccine Trials Network at the Hope Clinic and was the site principal investigator for the Moderna study here at Emory University at Grady Hospital. Dr. Mehta is an associate professor also of medicine in the Division of Infectious Diseases at Emory University School of Medicine. He is the assistant director of the Transplant Infectious Diseases section and the chief of the Infectious Diseases Services at Emory University Hospital and Emory's Orthopedic and Spine Hospital. Dr. Mehta is also a member of the Serious Communicable Diseases Unit at Emory University Hospital. Welcome to both of you today, and thank you so much for joining me for this Facebook Live event.
Thank you.
Thanks.
So today we're going to be talking about the fact that yesterday, the full approval from the FDA was received for the Pfizer vaccine. But first, we're going to go over our most recent update on COVID-19 numbers. The Delta variant, which makes up now more than 93% of all cases of COVID-19 across the United States, has had cases, deaths, and hospitalizations soaring in recent weeks in the United States, primarily among those who are currently still unvaccinated. And this has unfortunately erased months of progress that we were making towards keeping COVID-19 cases down. The South continues to break case records, with Mississippi, Florida, and Alabama leading the nation for cases, and with each of these states having more cases a day now than at any other time we've seen so far in this pandemic. Thankfully, the states originally hit hardest by Delta, Missouri, Arkansas, and Louisiana, are all seeing cases start to slow down. In the United States, we are only 25% lower currently with cases of COVID-19 each day than we were at the peak of cases in January. In the past 7 days, we've had 870,000 new cases diagnosed, averaging 147,000 cases a day. This is a level we have not seen since the end of January and is up 13% since just last week. Hospitalizations are also up with a current 7-day average of 78,000 people in the hospital, which is up 9% since last week. Hospitalizations for children and adults over the age of 50 due to COVID-19 are at the highest level we've seen so far in this pandemic. Almost 78% of ICU beds in the US are currently in use, and roughly 1/3 of adult ICU patients are in the ICU due to COVID-19. In Alabama, they have more ICU patients than they have beds. This means that there are patients who qualify for the ICU who are not in ICU beds and are either in the ERs or in regular beds. In Georgia, Florida, Mississippi, and Texas, 93 to 94% of all ICU beds are full, and at least 11 other states have more than 80% of their ICU beds filled. Currently, we are averaging more than 1,000 deaths a day in the United States due to COVID-19, which is up over 56% since just last week. The CDC has changed their masking guidance for vaccinated people based on community transmission levels, and currently 90% of the United States has the highest level of community transmission, while another 6% are at the substantial transmission level. Only 2.8% of counties in the entire United States have low transmission levels of COVID-19. The US has currently vaccinated 171 million people, with currently 51.5% of the US population fully vaccinated. 62% of the adult population is fully vaccinated, and this is higher when we look at older adults. 81% of the US population over the age of 65 are now fully vaccinated. Alabama and Mississippi have the lowest vaccination rates in the country at less than 37% vaccinated, and they are two of the states with the highest numbers of cases in the United States. Most states with vaccination rates less than 45% are currently in the southeast of the United States. So we are going to turn first to some very good news. Yesterday, the FDA gave full approval for the Pfizer vaccine, with more than 202 million doses of Pfizer having been administered across the United States under their emergency use authorization. We now know from the trial of 44,000 people who were aged 16 and older that the data shows that these vaccines are incredibly safe. So Dr. Kelley, turning to you, first, let's discuss what is the difference between an EUA, an emergency use authorization, and this full approval from the FDA that Pfizer received yesterday?
Sure. So emergency use authorization is something that the FDA is able to invoke in the setting of a public health emergency, which I think we can all agree that the COVID pandemic has been an emergency of public health, when there are no other available or effective treatments or prevention modalities for disease. And that's the case that we were in with COVID-19. And so they do a very brief and quick by FDA standards, a review of the clinical data to determine whether the product looks to be safe and efficacious. And that was surpassed anyone's expectations last year, when both the Pfizer, the Moderna vaccine, as well as the J&J vaccines all seemed to be very effective and very safe. And then after that, the manufacturer, the company, will submit for full FDA approval. And that is a more extensive and more rigorous review of the data. The FDA will actually go out and visit sites and inspect their data to ensure its quality and its accuracy. And in addition to that, the FDA will also get data on the manufacturing process, on the quality of the product, on the purity of the product, and will also go out and visit those manufacturing plants and make sure that they are meeting the standards that we require in the United States for FDA approval of drugs and vaccines. You know, something to note is that we have such a stringent and rigorous approval process, that is really tops in the world, and that many countries just defer to our FDA. Once our FDA approves something, many countries across the globe will just say, okay, well, we'll just take the FDA approval as approval that this is an excellent product. And so I think that, we can feel very confident now that the Pfizer vaccine has that full FDA approval, that its safety and efficacy are confirmed, and that everyone should be getting vaccinated as soon as they possibly can.
Thank you. I think that's really important to note how the FDA is viewed across the rest of the world and the credibility that they carry. I did read that the actual report that was submitted to get this full approval was close to 500,000 pages long. So it was not an easy thing for them to wade through. The original EUA was based on 2 months worth of data, both safety and efficacy data. Can you talk why that 2 months is an appropriate amount of data to have been reviewed for the EUA?
Yes, because we have a long history of very successful vaccines that have been implemented for many infectious diseases, and in certain cases even eradicated those infectious diseases from the globe. We know well how long we should monitor people after vaccination to observe for any side effects. And in almost all cases, any side effect from a vaccine is generally seen within 6 weeks of vaccination. And it's for that reason that FDA requires 8 weeks of clinical follow-up of safety data before they would consider a vaccine for emergency use or full approval review. So that 8-week mark is really magical in that after that point in time, the vaccine is really out of people's systems. What remains is immunologic memory, not the vaccine. And so that, is a very good thing. And we know that, side effects are not going to occur except in very, very rare instances past that mark.
Great, thank you for that. Dr. Mehta, I'm going to turn to you for a second. There have been some really large surveys done of folks who've not yet been vaccinated in the United States. One of the largest is from the Kaiser Family Foundation, and they found that about 30% of folks who've not yet gotten vaccinated say they were waiting for this full FDA approval. What is your thought on if that means that this is significant enough that we're going to see that 30% move towards getting vaccinated?
Well, Dr. Guest, I think it is really important that we have FDA approval, because there is a significant group of people that were waiting on that for their own confidence to get the vaccine. And I'm very hopeful that a large proportion of those people will go ahead in the next several days and get the vaccine. And already in some discussions I've had, we've seen people who have been waiting now getting vaccinated. We've been having vaccine drives in our hospital, and I'm seeing many more people in line to get the vaccine. I think the other really important aspect of having this FDA approval is it gives a lot of companies and workplaces the confidence to start mandating the vaccine to keep their workplaces open, keep their workforce stable. And I think that's another important thing that we will be seeing in the coming days, is more companies doing that, and therefore more and more vaccinations occurring.
So you do think that we're going to start to see a rolling number of new requirements for vaccines based on this approval?
Yes, I'm hopeful, and I think we're already seeing that, both because of the approval and the greater expansion of mandates. We're seeing a slight increase just in the past few days of the number of people getting vaccinated. I think a little over 850,000 consistently over the last 3 days.
Great, thank you. So this full approval is for those who are aged 16 and older with Pfizer, and the EUA is still currently in existence for those who are 12 to 15 with Pfizer and those who need a third dose for an immunocompromised condition. Any speculation on when we might see an EUA added for Pfizer for kids who are under the age of 12? Either one of you.
Thanks. I think we don't know for certain, but we hope that it will be within the next 1 to 2 months, potentially. It's really hard to say. It's been a bit of a moving target. And I think until Delta, there was a little bit of momentum lost. But now that we're seeing Delta and the terrible impact it's having on kids and schools and children getting sick, there, I think, is a renewed kind of commitment to getting the FDA approval down to age 12, and then even getting kids younger that emergency use authorization. So it's hard to say. I think FDA has a lot on their plate. There's a lot of things that they need to be reviewing and considering for either emergency use authorization or full approval. And so we'll have to see what ends up being prioritized, but I can't imagine that kids aren't at the very top of the list, finally.
Yeah, absolutely. So I'm going to ask you to speculate on one more thing, Dr. Kelley. As one of the site PIs for Moderna, when would you speculate that we'll see Moderna go in for full FDA approval as well?
Well, very soon as well. You know, like I said, there's a lot on the plate of the FDA, and full FDA approval of Moderna and J&J will also be on the docket very soon. And so, you know, time will tell how things get prioritized and approved in the next, 2 to 6 months. But I don't think it will be too much longer for those products either.
Thank you. Dr. Mehta, currently the FDA has authorized a third dose of either Pfizer or Moderna vaccine for a very small percentage of people, estimated to be around 3% of adults with severely weakened immune systems. Can you explain why this dose is different than a booster? It's adding to the vaccine schedule, and who exactly is in this population that needs this third dose and why?
Yes, we were very happy to see that addition. As someone who takes care of immunocompromised patients, specifically cancer and transplant patients, we have seen data from our colleagues around the world showing that even after 2 doses of the mRNA vaccines, many of our transplant patients don't have significant levels of protection. And that's specifically measured by the levels of antibody in their blood and also the number of T cells and B cells in their blood. And so the FDA has authorized a third dose to help get patients in these special categories to a higher level of protection. And the understanding that they never actually got a full level of protection like many of us in the community did with the first 2 doses. And they're specifically asking for patients that are solid organ transplant recipients, patients that are receiving chemotherapy or have recently received chemotherapy for solid tumors or hematologic malignancies, patients with advanced or untreated HIV, and patients that have received stem cell transplants or getting immunosuppressive medications for other reasons, that these patients are now all eligible to get their third dose. And I'm really proud of the effort that Emory Healthcare recently put together to create a large vaccine marathon this weekend, where we were able to give over 1,000 patients that fit these categories either their third dose, or in some cases their first or second dose. And it was really amazing to see that turnout and the patients really wanting to get themselves protected.
That's fantastic. I love hearing positive stories, and we saw such huge events for vaccine to give out vaccines at the beginning when we saw more of the population eligible, and then vaccine sites have been kind of on the small side lately. So it's great to hear of another big one. Let's talk about how important the vaccines remain during this Delta variant surge that we're seeing. To remind everyone again, Delta is currently about 93% of all cases of COVID-19 across the United States. And we know that the Delta variant has shown itself to be more transmissible than previous variants. And so exactly how well, Dr. Kelley, do you think the vaccines are doing at protecting us against the Delta variant, given that it's been a game changer in so very many ways?
I think the vaccines are doing a fantastic job in that we see very, very few people that have been vaccinated who end up in the hospital or unfortunately dying. So I'm not sure what the latest stats are right now, but somewhere between 90 to 95% of folks in the hospital in general across the country are people who have not been vaccinated at all. A very small percentage of people who have been vaccinated actually end up getting very ill from COVID. And that is what the vaccines were designed to do. That's what we expected them to do. I think initially we became, elated when we thought that the protection was going to be even better than just protecting from severe disease and death. And I think Delta, rained on that parade. But they're still doing exactly what we had hoped they would do, which is to save lives and reduce morbidity and mortality. We are seeing more breakthrough infections with Delta than we saw with the previous wild type variant and the other variants, the previous wild type strain. That is unfortunate. But at the end of the day, a breakthrough infection that doesn't end someone up in the hospital or unfortunately dying is really more of a nuisance than anything. And so we still have extreme confidence that our vaccines are working very, very well, and need to ensure that everyone get vaccinated as fast as we can.
I think what you brought up is such a great point. And Dr. Mehta, I'm going to ask you to kind of highlight it even more. The vaccines were designed to do what? To prevent infection, to prevent severe illness, to prevent deaths. Where were they really meant to target at first?
So as we all who are working in healthcare and everyone in the community saw, that we were filling up our hospitals in March, April, May of 2020. And what we really needed were mechanisms to prevent our hospitals from being overwhelmed, so that we could take care of patients with COVID, but we could take care of patients with all other types of diseases as well. And that is one of the major advancements of the COVID vaccines, is that they do prevent infection, but more importantly, they prevent severe illness, critical illness, and death. And so they're keeping patients, even with COVID, from having to come in the hospital and using up vital healthcare resources. Unfortunately, with this current surge of Delta virus, our hospitals are full, our ICUs are full. We just over the weekend, my colleagues in rural Georgia and South Georgia are exhausting their supplies of critical care mechanisms and trying to transfer patients to any hospitals that have these tools. And here in Metro Atlanta, all of our ICUs are now full. And so we're looking at transferring patients out of state, further north. Our colleagues in Louisiana, Mississippi, even Texas are trying to transfer patients where they can get the care that they really need, but can't be delivered locally.
And so let's make a slightly more specific point about that. Why does it matter that our ICU beds are full? Why does it matter obviously it does to that one patient, but why does it matter to the rest of us who are not currently in the hospital if our ICU beds are full?
Yeah, Dr. Guest, it matters for many reasons that our ICUs are full. So most importantly, we need to take care of critically ill patients with all the tools that we have. And when our ICUs are full, we put critical stress on the staff, on the supply lines, and the tools that we use to take care of these patients. But also importantly, we need to have room to bring in more critical ill patients. And that's not only for COVID. We have patients that need heart surgeries. We need patients that need chemotherapy. We have patients that need transplants. We have to have the ability to take care of all the sick members of our community. And if we have tools to prevent people from being in the hospital, from being in the ICUs, it is critical that we use those tools to, again, to establish health and wellness for everybody in the community.
Thank you. I think it's important to remember, that the ICU beds were not empty prior to COVID. They were used for really sick patients before, and that's what we need them to be available for, including people who have accidents and things that, certainly we're not planning for. How does it feel right now in your hospital?
So Dr. Guest, here at Emory, we are quite busy. Our nurses, our physicians, all of our ancillary staff are working 100%, and they are doing their skills. They are practicing medicine at the highest capability, but it is tiring. And it is hard to watch so many patients be ill. We are doing our best to get them back home to their families, but it is a completely full hospital. And many of my colleagues around the city, I'm sure Dr. Kelley can comment about Grady Memorial Hospital, but we are all working to our full capacity right now.
Yeah, Dr. Kelley, Grady has been on diversion for quite some time. So how is it going at one of the 5 largest hospitals in the United States?
Yeah, I mean, Grady is quickly approaching its peak from the winter surge of hospitalizations. The ICU, yes, is at capacity. The emergency room is constantly on diversion, and that's a really, really bad thing. If you or a loved one is in a car accident and you need that trauma care that is sometimes necessary after a bad car crash, you may not be able to get it. If you have a tumor, a cancerous tumor that needs to be removed in order to be cured of your cancer, that's something that needs to be done in a timely fashion. Those operations are being canceled because there's no bed to take care of the patients after they come out of their surgery. And so it's really just a horrific situation to be in. You don't want your nurses and your doctors and your other care team, you don't want them tired and exhausted and overwhelmed. And unfortunately, that's the situation that we're in again, for the 4th time. And so it's really just a sad and unfortunate position to be in that was almost entirely preventable.
I think that that's important. And, we're starting to talk about a term called compassion fatigue and how incredibly hard it is to keep walking through this cycle. And it feels different now that there is a form of prevention out there that we can use. And that form of prevention does work very well, keeping people from being sick enough that they have to be in the hospital, which is, of course, what we want to keep everyone from having to do. Let's move from vaccines for a moment to other forms of prevention that are needed that the Delta variant has brought back into play as being incredibly important to slow down the current spread of Delta. It's important to recognize that there is a distribution across the United States right now of cases of COVID-19 that are very tied to vaccination rates. But on top of that, there seems to be some similarities with states and communities that also use masks pretty well. And so as we've had our kids go back to school, we are starting to see a lot of news headlines, and a lot of us know about people whose kids are already in quarantine or are concerned about cases in their schools. So what is really your best advice for how we can protect children who are under the age of 12 and not yet eligible to get a vaccine but we want them back in school because it's the right and best way for them to learn if they can be safe while doing so.
Well, Dr. Guest, as you know, I have young children. Dr. Kelley has young children. I think it's really critical for us to get our children back in school safely for their own education, but also for all of us parents to be able to do our work and contribute to society in the ways that we need to. I am very much a believer in that children wearing masks in school while they're indoors is very important for preventing the spread and keeping children in school, for protecting those teachers as well. We need those teachers in the classroom. And so I'm very happy that our school and many other schools in the Metro Atlanta area have now mandated masks for students while in the classroom. And I think that will hopefully help keep those children there in getting their education.
Thank you. Dr. Kelley, anything to add?
Yeah, I mean, I would only add that, you know, the struggle with masking, which is so super critical important. I mean, when you're in an environment where 100% of people are masked, it's actually a reasonably safe environment to be in, vaccine or no vaccine. The point is we don't want to be wearing masks for the rest of our lives, right? Nobody does. It's uncomfortable. But we have a finite period of time where we need to get through this surge. We need to get more people vaccinated. We need to get our kids vaccinated, but there is an end game, and we can reach that, and we can reach that end game together, but it's going to take a little bit longer, unfortunately, and that I think makes people very frustrated. It makes me very frustrated, but I know that this isn't forever, and I know that if we can continue to adhere to the masking and continuing to get as many people vaccinated as we possibly can, including our kids, that there is an end game, and that we are not wedded to masks for the rest of our lives. And so if people can kind of hang on to that temporariness and hang on to that hope that things will get better, I think that we can get through it.
Thank you. I love that positive approach. It's also just that consistent message of we're all in this together and we all have a role to play in this. And right now, I think a lot of conversation nationally has turned to how do we protect our kids that are going back to school. The Southeast are already back in school. The Northeast goes back a little on the later side, but they're back in school and that's where we want them. And this is how we protect them. Adults around them being vaccinated and everyone wearing masks while they're indoors right now. The CDC took this seriously enough that the data supported the need to bring masks back for even those who are vaccinated. And there was some language saying, that we were reverting back. And really, I think that the better language is we were moving forward with Delta and figuring out how to use science correctly. And so let's just review really quickly in the last few minutes, what is the current guidelines for CDC about wearing masks if you're vaccinated?
Well, I mean, I would say masks are now necessary for everyone, regardless of your vaccination status, when you are in an indoor setting where you don't know the vaccination status of everyone around you. I would also say, there's no setting anymore where there's not even some risk associated with that. And so each person needs to figure out what their personal risk tolerance is. So, small indoor household gatherings where 100% of the people there are vaccinated, that's going to be very low risk, but it's not going to be zero risk anymore. And so everyone needs to kind of have that knowledge and decide amongst themselves, what is their risk tolerance for those types of environments. But public settings, indoors, it's a no-brainer right now. There's so much circulation, there's so much transmission, masks for everyone, regardless.
The CDC used a threshold of this high transmission or sustained transmission, and currently 96% of the United States is in this sustained or high transmission level. And if you look at counties in the state of Georgia, there's not a single county that doesn't have high transmission. And if you look at the 14 states that surround us, there is not a single county that is not in the high transmission zone. So really, there's almost nowhere you should go in the United States where you're not going to be masked indoors if you're following CDC guidance. And that CDC guidance also includes, regardless of transmission rate, if you happen to be living in one of those 2.8% of the counties that are at low transmission, still in a K through 12 school, the guidance is to be masked for everyone who is in that building at all times. Okay, both of you, thank you so much for discussing where we are with vaccines. What is your one real plea to get people to vaccination if they've not yet made it?
Well, I will say that in my family, we've had this discussion many times, and now even my children are vaccinated. And we are doing it for each other, we're doing it for our community, and we're doing it to get back to the life that we want to all be living without mask and with freedom to move and travel around. And so we can only do that if we are all doing it together and we are all vaccinated.
Thank you so much, Dr. Mehta. Dr. Kelley?
Yeah, absolutely. I totally agree. And the only thing I would add is, people need to know that we have more evidence of the safety of this vaccine than we do for any other vaccine in the history of medicine. We know more about this vaccine than any other vaccine. It is safe. Millions and millions of people have been vaccinated, some of them as many as a year ago, and we are still not seeing any indications of safety concerns. And so, if the concern is that we still don't know enough, that's just not the case. We know more about this vaccine than any others, many that people get without even thinking, tetanus shots and measles shots and those sorts of things that we all know that are necessary. So if you're concerned about the safety, I would say that, reach out to someone in the know, reach out to your healthcare provider, let them answer those concerns, and they will tell you resoundingly that the vaccine is safe and that there are no concerns to moving forward.
Wonderful. Thank you all so much for joining me. And for those of you who are watching, please remember your vaccine is your largest form of protection right now, particularly with the Delta variant. Your mask is incredibly important. I'd like to think of it as you need your vaccination, at least one other form of protection right now. So please remember it's safer to eat outdoors, and please wear your mask when you're indoors. Stay safe, everyone, and we look forward to seeing you next time. Dr. Mehta, Dr. Kelley, thank you so much for joining me. Bye-bye.